The truth is, Black and brown communities have been in a state of crisis long before COVID-19 and the public lynching of our brother George Floyd. I've spent the last 10 years of my career addressing and combating the death gap. Even before the Rona, there has been a 20-year life expectancy gap in the city of Chicago between communities of color and affluent communities. It is the largest life expectancy gap in all of the nation, larger than New York, which is more populated, and larger than Detroit, where more people are living under the poverty line. A lot of this has to do with how segregated our city is. In fact, Chicago is historically known to be the most segregated city in all of our country. So it is very easy to see where resources are being distributed and where they are intentionally not being distributed in our city. Now, health disparities are not isolated to the city of Chicago. This is a magnified reflection of the consequences of systemic racism in our Black and brown communities at large. Throughout this talk, I will give you my personal insight on strategy that has proven effective when building a community of resistance. But what I really hope is that I inspire you to take action, challenge you to think deeper, and attack inequality at its core, and place the honor and pride back in the responsibility we all have to contributing to a movement against structural inequality. So, I have 3 foundational steps to building a community of resistance. Are you ready? Foundational step number 1, identify the injustice. Inequality is the killer of our communities, not disease, nor the misconduct of a few policemen. 10 years ago, my sister and I co-founded a program called the Youth Health Service Corps. That program now functions in 21 different public and alternative schools in underserved communities of Chicago. With the help of nursing and medical student volunteers, we teach our 7th through 12th graders about disparities, specifically about the 20-year life expectancy gap that exists in their city. They learn about the 5 diseases that cause that life expectancy gap. I'll name them: hypertension, diabetes, HIV/AIDS, cancer, and asthma. Not only do our students learn the makeup of these diseases, the symptoms, the treatment, but they also learn to screen for early detection. After they have completed this curriculum, they are then responsible for finding 10 people in their family or in their community to perform those screenings. Now, the reason why looking to the next generation for justice in public health, or justice in general, is so genius is because when we look at the dynamic of this generation on the spectrum of all the generations that make up our Black and brown families and communities, this generation is already acting as the translators, the carriers of new information, and the liaisons to technology. Essentially, this generation was born into leadership. By including this component of service, our students not only identify the injustice for themselves, but they then become the carriers of that identification to the rest of their family and community members. We have to think more creatively when trying to expand the collective consciousness. And who better to look to than the next generation? Which brings me to my 2nd foundational step when building a community of resistance: observation and participation. Create a clear and visible strategy to organize a model community of resistance. In 2016, I was a collegiate athlete turned personal trainer. During my time in the fitness industry, I learned much about how nutrition and fitness could ultimately help prevent disease. In addition, I quickly came to understand the plight of fitness professionals of color. There is a high percentage of fitness professionals of color serving predominantly affluent white communities because of the access to sustaining a livelihood. Now, the need for disease preventative resources is so obviously overwhelming in Black and brown communities, but there was no profitable infrastructure in place to allow for those resources to reach our people. So, we created Healthy Hood by providing $5 fitness classes and wellness workshops and allowing our instructors to keep their profits. Healthy Hood became that infrastructure. It became a model community where members could apply their specific skills and resources, still make a living, but contribute to combating the root of the injustice. And by identifying that injustice at the start of every class and every workshop, instructors and participants alike became natural advocates of the mission, inspiring others to join in and find their role to play as well. Healthyhood started as a response to the lack of emphasis on preventative care in our healthcare system. But what it quickly unveiled was the reality that if we were actually going to be able to influence the possibility of a healthy lifestyle in our Black and brown communities, we would have to take a more holistic approach to address the consequences of systemic racism. Which leads me to my third and final foundational step when building a community of resistance. Develop a collective of collectives. Create the energy that everyone has a role, and every contribution is valued, not measured. We do this by means of revolutionizing your current practice. This allows the space and the freedom for members to design their own role in the collective resistance. Teachers, students, artists, musicians, mental health professionals, etc. Everyone has a role. There is no hierarchy, only peers. This culture encourages members to embrace who they authentically are and what skills and resources they specifically bring to the table. The collective resistance adds value to the action, honor to the responsibility, and passion to the purpose. Now Ciobia and her team of 20+ fitness professionals are not just teaching a class to help people get fit, but combating systemic racism. Now Victoria of the Get Your Mind Right initiative is not just giving a talk therapy session to adolescent youth, but challenging the lack of mental health services in our communities and exposing the flaws in our healthcare system. And Daisha, the high school senior founder of the Young and Woke Social, is not just throwing a party for her friends, but disrupting the narrative that the youth are the problem and creating an avenue where the youth can be the solution. Now, when the virus attacks, or the next crisis, the next case of police brutality, or the next family separated from deportation, we are ready. We got us. We have an infrastructure in place to create momentum, the means to rapidly distribute information across many communities, to ignite the collective resistance. We got us. It is more than just a physical community, but a spirit, a culture, a movement. COVID-19 magnified what we already knew. Yes, the death toll is disproportionately affecting Black and brown communities. Statistics say because folks who have pre-existing conditions are left more vulnerable to the virus. But what we already knew is that our Black and brown communities were already overwhelmingly victimized by those pre-existing conditions. Not because those diseases or because this virus discriminates, but because of the structural inequalities in place. The real underlying pre-existing condition is systemic racism. I'm going to conclude with a vision that is arising among many in my generation. On the one hand, our nation, our world, faces new challenges of both climate and disease. But on the other hand, there is a growing awareness of the consequences of systemic racism. And as a result, a growing collective resistance. Our experience demonstrates that there is a powerful force for public health and justice that is exploding in our communities. It is young, it is bold, it is creative, and it goes beyond just serving a physical community, but it is we got us. It is not enough to create an island of equality in an ocean of injustice. We must not waste the current exposure of the severe brokenness of our systems. But with a sense of urgency, we must demand transformation. So build a community of resistance. Join the movement. All power to the people.